So I think a great place to start when you're initiating the discussion around navigation metrics is start that conversation at the Cancer Committee. Many programs are a part of the Commission on Cancer accredited program, and they have to drive quality for their cancer care. So this is a great place to have discussion about the cancer program as a whole. What are their gaps and barriers in care delivery, and where does navigation fit into that process to help provide solution? And then where does it make sense of what measures or metrics need to be captured to help tell the story to drive process improvement change? Because across that table, you have your key stakeholders. You have your hospital administrator over oncology, you have your key physician team leads, you have somebody from the quality department who is overseeing the quality initiatives in the cancer program, as well as your other key healthcare team members. So to me, that's a great place to start the conversation. And then you can break off into a smaller subset of teams to have some discussion about where to really dive in deep and get started, and then pull in other key members to help actually execute the work.
It's great. And with those key stakeholders that Danelle just mentioned, is sharing with them the actual toolkit. You know, looking at the different modules, actually looking at the value-based cancer care initiatives and the metrics from the Oncology National Standards that support the navigation metrics, and really choosing ones that are very important for your cancer program. And then, as Danelle said, take that smaller group and figure out what that process is going to be for collecting that metric, and how often do you want to collect that metric. But the buy-in from the key stakeholders, administrators, your physicians, your PI, tumor registry, clinical trials, whatever that key group is absolutely key, because it really does take the entire team to really work through the process and the outcomes.
And I think the one important piece too is whether it's coming out of the Cancer Committee or identifying that navigation leader, or if it's the navigator, but creating one voice around metrics and why is this important for the program. When it gets up to the financial individuals within a healthcare system, that CFO and those decision makers, coming down and identifying and saying, if we have these metrics, we'll be able to demonstrate, again, that importance of that return on investment, and how, not only the return on investment, but how this is impacting our patients for the better, because we're able to measure whether it's 1, 2, or 3 of the identified metrics. And I think that's probably one of the biggest pieces too, is, starting small, as Danelle said earlier, find that low-hanging fruit that is important to the program, and then translate it, as Tricia even mentioned, to the measures, value-based care, whether it's COC, et cetera. And I think that's another, again, valuable tool that we included within the toolkit, is how the metrics relate to measurement.
Monica, you bring up a really good point about, the conversations, those critical conversations you need to have. And I think an important element to call out, which is addressed in the toolkit, is know your audience. Who do you need to present the data to, and what's the story you need to tell? Because that story may look very different to your C-suite administrators, right? Because they're going to want to know what's that return on investment. Where if you're presenting to your physician teams, maybe that story is more focused around quality outcomes, patient satisfaction. So know your audience and know how to tell that story to the audience. And as I stated, the toolkit does help provide some guidance around that, which is very beneficial.
Just one more comment. Again, I have to echo what Monica said. It's all about the patients. We all want the very best for our patients and their families going through this very tough journey. So it is all about the patients and the outcomes. And that's the success of the metrics as well.
Nicely stated, Tricia, and I agree 100% that we're all doing this work with the patient at the center of what we're doing.